Okay, ready? All right, so I'm Erica Westling, or Erica Spillman. Anyway, I'm a McKendree student working on telling you all about how to use central vascular access devices. What we need to know for as an outpatient nurse. So, let's see. So what are the common types we see? So we see PICC lines, we see multi-lumen central catheters, and we see tunnel catheters or Hickmans, and also portacats or power ports. So PICC lines we'll talk about first. So PICC lines are inserted peripherally and then they go into the heart. And that's how they generally check replacement with that rhythm that they're looking for. So power PICCs can be safely used by medical imaging, but power injector. So you're going to look for this power lock whenever you're inserting these kind of power PICCs. PICC lines can remain in place for up to a year. They're free of complications, and the PICC lines can be used for administration of blood products, medications, IV fluids, and TPN, or total parental nutrition. PICC lines can be used for blood draws also. So what are reasons not to have a PICC line insertion? Well, if they have a subclavian thrombosis, or chronic renal failure, end-stage renal disease, paralysis of an extremity or that's planned for the insertion, mastectomy to that side, pacemaker, or hip deformity, the Midwest Nursing and Vascular Services will determine the need for that. All right, so I've made a little checklist that some of you may have seen on our unit, but have I called MN, or Midwest Nursing Vascular Services, inserts our PICC line. So I made a little checklist that, we need to call them, we need to set a time, we need to have the patient registered with stickers available, we need to have a kit for them, which now they're looking for the PICC Solo, which is more the saline flushing of the PICC line. So there's numbers there to call, and then you need to have a permit available, which is also in that binder, and orange card ready. And they like an extra bedside table because they have a lot of equipment that they like to put their equipment on, because they use the 3CG cardiac waveform capnography type stuff to check for placement. And if they can't check placement that way, they do chest X-ray, which they will tell you. So how do you care for blood PICC lines? So no blood pressures in that arm. You should measure that length of that catheter daily, and when dislodgement is suspected, and of course document that. Measure the circumference of the arm. So should have it as a baseline when insertion, and then if it's more than 3 centimeters, call Midwest Nursing Vascular Services, and then never use a syringe smaller than 10 cc's. So that accounts for every central line. Do not clamp ports that can cause it to clot, and then never allow to get wet. And then also notify the physician if any redness, swelling, signs of infection. Notify if there's shortness of breath, chest pain, and it's also recommended to have daily or steam baths, but that's for patients that really are more prone to infections, I would say. But you want to prevent infections, of course. All right, and then flushing them. Of course, we always perform hand hygiene and clean our hands, scrub the hub for at least 15 seconds with an alcohol swab, or remove that passive infection, the swab, the cap, the swab cap. And then because we share patients from other facilities, it's important to read the label of the catheter. So got a little picture here. So this is a power PICC. This is what we used to use with PICC lines. So you would see the labeling of the power PICC there. It's the PID tag, and it has the 5 milliliters per second. It's got all the labeling on there, but we now want to use, the power PICC, I guess I'll keep going with that. So 10 milliliters of normal saline, and now we're doing 1 milliliter of heparin, and that's 10 units per milliliter of heparin that we want to use for that. And we want to use that pulsating start, stop kind of flow to kind of keep the compensating, yeah, to keep the line free of debris and clots and that kind of thing. And then, if it does not say the Power Pick Solo, it requires normal saline and heparin after each medication and fluid and every 12 hours. And then if the mainline fluid is infusing, there's no need to flush with the heparin, of course. Okay, and then the Power Pick Solo, it looks a little different. You can see the labeling on the tubing there too. And then they want to have the blue color there that's supposed to signify saline only. So this is what our newest patient has that has had PICC line inserted. So you only need saline with these.
So do we know why there's only need for saline? Is there different material or something?
Yeah, it's the plastic in the tubing that makes it more permeable, that it's not going to clot as easily as the other ones. It says you're supposed to just flush with the 10 cc's every 7 days, and it will say the Solo on there, and they do not require heparin, and they're flushed after every medication and every 7 days otherwise. So those are much nicer than the other ones.
Rather than every 12. Oh.
Yeah. Your question? Okay. So PICC line dressing should be changed on the day of admission for admitted patients that arrive with it in place, and then otherwise 24 hours after the dressing was, or after the PICC was inserted. Sometimes they get a little blood around the catheter that you want to change it, 24 hours after it's inserted, or every 7 days, especially, or and then as needed for drainage, moisture, or impaired integrity. So mark the dressing with data initials. We all know this stuff. And then document the appearance at site and use the protocol for technique used. Of course, it's the sterile technique, the mask, the sterile gloves, and then PICC line dressing should be changed, like I said. And then use the step lock to keep it in place, which I got right here. So that's this little device. So we'll use that to secure it after we've cleansed the area, of course. And then follow the protocol and then document everything. All right, and then multi-lumen or central lines, or CDPs, I always called them back when I worked at St. But anyway, it's usually inserted in the jugular or in the subclavian veins, intended for short-term use, less than 30 days. Due to higher infection rate, the femoral vein should be avoided, of course, but we don't have to deal too much with them inserting them here, hopefully. But proximal lumen is 18 gauge, the medial is also an 18 gauge, and then distal. And then this so the white lumen is the proximal, and then the blue, which would be the longest one, would be the medial, and then the distal port is the red one. That's what kind of it looks like on the where the sites are that it's opened, or where you're injecting the venous fluid.
So this is the longest.
Right.
And then 2 is the medial. Okay, that makes sense.
Yeah. Closest to them. All right, so change dressing, same thing, every 24 hours, or after 24 hours if it's soiled, and every 7 days, and is needed for drainage, moisture, impaired integrity, all that. Follow the protocol and frequency, document appearance, mark the dressing with data initials. This is all kind of same old stuff. And then flush with 10 cc's of saline after each medication. And blood draw, and at least every 24 hours. All right, and then the Hickman is the next one. So that's called more of a tunnel catheter, because they're tunneling it under the skin a little bit and into the heart. So tunnel catheter also is like the Rauschon, Robiac, and the Hickman. They all fall into this category. But we most often see that Hickman for that chemotherapy. We've been seeing that lately. So dressing changed like all the others after 24 hours if soiled, and every 7 days. So the reading says the minimum flush volume should be equal to twice the internal volume of the catheter system plus the add-on devices. Well, after I found found several articles. Most of them went between 2 and 5 milliliters up to 10 unit per milliliter of heparin is what I most commonly found. But otherwise, you're going to follow the physician's order anyway. Tells you to do. All right, and then Portacath. Use those many times. So we have the power port and we also have the Metaport. So the power port, that is the one we're looking for to use with CTs because it has a 300 pressure per second. It can hold more of a pressure to it so that if the CAT scan wants to deliver a dye to do a CAT scan that's going to show better pictures for them, then that's the kind of port they would have to have. They cannot use the regular ports because they can rupture and break apart with that pressure. So the difference is the power port, the bar company, they said the maximum recommended pressure is 300 psi. The port must be accessed with that pressure rated. So this is the actual the pressure rated Portacath needle. So you can access the power port and the regular ports with this needle. But if it was staying in long term, you'd want to make sure that you had not for CT on a patient that had just a regular port because you don't want them using it. And it is the time for the port. But generally, you can tell by the triangle shaped of the power port and the knobs on it that it's a power port and not a threaded port. So anyway, power port, imaging required a 20-degree needle, and then tubing connected to the needle must be labeled as a power port, and then if they're unable to confirm that it's actual power port, then they cannot use it. And then a regular port, not to be used for medical imaging injectors. Circular portal is typically made from like a silicone bubble, and this appears like a small bump in the skin. Portal made of special self-sealing silicone, so it can be punctured by a needle repeatedly before the strength of the material is compromised. So its design contributes to a very low risk of infection. So similarities, they both must be accessed under sterile technique. Of course, you're going to just look for the protocol, and then both power port and traditional port can be accessed with a pressure rated. Like I said, this needle here can access both of them. They both require the 10 cc syringe. The smaller the syringe, the reason for that is because the smaller syringe, the more force that's placed on the device. So 10 cc is the minimum amount of pressure that we want to put on the device. And then, so every 48 weeks that needs to be flushed with heparin. It should be the 500 milliliters of 100 per units per milliliter of heparin. And then flush with 10 to 20 cc's after each medication or blood draw. So, important things to remember about all devices, of course, the transparent membrane, dressing, and tegaderms and advanced tegaderms are changed every 7 days and sooner if they're compromised. The gauze dressing changed every 2 days and if sooner if compromised. And then if gauze is used, now this is something I didn't really know before, that to stabilize the implanted port and you can still see the site, then it's not considered a gauze dressing. So it still can be changed every 7 days. And then chlorhexidine is used in all the sites, 30-second prep time, and then a 30-second dry time. Don't blot, fan, or wipe away. Mask is to be worn by the patient and the nurse before performing the dressing change. And the use of the disc. So these BioPatch discs are to be applied to the central lines, especially Hickmans, PICC lines, and multi-lumens. But they're not so practical for ports since there's so much space between the port and the dressing. And then, of course, you want to make sure the blue side is up. It does have the up arrows on it, so that side does say up. And then it's a general rule for pretty much all, anything with a line in it. The push pause method is probably the best method. Push 1 milliliter at a time for the 10 milliliters into the catheter, creates a turbulent flow within the lumens and decreases the risk of fibrin and platelets from becoming adhered to the internal walls of the catheter, which minimizes the risk of occlusion. Right, and then disinfectant cap that goes on to be used while the IV tubing or central line is not in use. Prevents bloodstream infections, so that's a good thing to always remember for patients that are going to be having these in for a long term. And then after removal, there's no need to cleanse the access port. As far as the this goes, this creates the wiping of the port. So this, you don't need to get another alcohol swab out and wipe that port again. That doesn't hurt anything. But and then so it has to be on at least 5 minutes prior to using the port. And it can stay on up to 7 days after replacement, and then it's a one-time use only. So start it after that. All right, I think that's all I have. Any questions about anything?
So the home catheter, what is that classified as? The home? Is it a central line or a tunnel?
I think that's more of a tunnel. The home, I think it's used for dialysis, right?
And we had that one patient with it
Yeah, that was,
but he's getting chemo.
oh, yeah. Could add that. I don't
Look it
know.
up.
I would say it's a tunneled catheter, but yes, it's a central line. They're all central lines.
Anything that goes into a central artery, that, into the heart, it's tunneled, yeah, so.
Central
Even
vessel.
central line, yep.
The PowerPix solos, are they the new thing? They're gonna be taking over all of the PowerPix.
That's what the company has asked us to supply now, so we are keeping those in stock, right?
Mhm.
So that's what we're inserting here now.
So
too.
only saline.
Yeah, they're nice.
Thanks.
Yep, I think that's what our latest guy has.
Mhm.
Wasn't just saline. Don't need the heparin anymore. That'd be nice. Because there's so many different variations, that's why I was trying to clear up some confusion. I don't know if I made it worse or better.
Did
Yeah,
you
good.
produce some kind of a chart that says this is home catheters, et cetera, this is what you do?
So you can speak to that too, right?
Yeah, the chart,
Mhm.
yeah. Do I have it on here? Or
So in MCN,
Oh, in MCN,
in the
yeah.
policy, the very end of the policy, there's a chart that has all the devices and all the catheters and what you flush it with and how much blood to waste, and it's all on there.
Yeah, we have a copy actually on our nurse's station. I've seen it, yeah. Protocol, but one more. No other questions? I do have a survey for everybody, so if everybody wants to fill out. Tell me how I did and what I could do to make
Great job.
things better. I'd like to hear it.
Very well done.
Some practice. No other questions? I had salad up here for everybody, but somebody took that away.
Salad? I would say,
When I was setting up the
wonder
room.
where the